Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, herpes viral encephalitis. Okay, so if you see in herpes viral encephalitis, it mainly occurs due to the primary herpes simplex 1 infection, and it is seen in children less than 18 years of old, or it can be seen in elderly patients over 50 years of age more commonly. So this herpes simplex encephalitis mainly caused by a retrograde transmission of virus from the peripheral site like on the face. From there, due to the retrograde transmission of the virus, it results in herpes simplex encephalitis. Now, because of this retrograde transmission of the virus, this will result in herpes simplex viral reactivation will occur. This herpes simplex virus reactivation will occur along a nerve, or it can occur along an axon. From there, it can reach the brain. And sometimes this herpes simplex viral encephalitis might also remain dormant in the ganglion of the trigeminal nerve. Okay, it might also remains dormant in the ganglion of trigeminal nerve. And sometimes in herpes simplex virus, olfactory nerve may also be involved. Now, if the olfactory nerve is involved, this olfactory nerve will send branches to the temporal lobe of the brain. Because it sends branches to the temporal lobe of the brain, this will result in, so there is more commonly the, so if you were asked, because it sends branches to the temporal lobe of the brain, if you were asked what is the most common site of herpes simplex viral encephalitis, the most common cause of herpes simplex viral encephalitis is in the temporal lobe. So on MRI, if you do an MRI, because it is involving the temporal lobe and sometimes even the frontal lobe, so there is frontal and temporal lobe enhancement is seen. Now, herpes simplex virus encephalitis is treated by the drug acyclovir, and if it is untreated, then death can occur in 70% of cases.
thank you and thank you for watching.